Okay, time to get a check on the latest COVID headlines with Dr. Isaac Bogosh. And Dr. Bogosh, over the weekend, there was an outbreak of the Delta variant in Calgary. We're hearing the UK, they are considering pushing back their full reopening because of the Delta variant. And we seem to ask this weekly, but the COVID story, of course, can change that quickly. Just how are you feeling right now about the Delta variant and its threat?
Yeah, we can't ignore that this is a more transmissible variant. It certainly is. There's overwhelming data demonstrating that. And this thing is so contagious that it will find unvaccinated people and undervaccinated communities. It will. We also know that the vaccines work. But 2 doses is much more protective than 1 dose, and that's why in Canada we have a first dose fast approach where we try to get as many first doses in as many people as possible. But now that's being followed up with this second dose approach to really get those second doses in quickly, especially over the coming weeks ahead and over the early part of the summer, because it is here and it is spreading and you can't ignore it. But if we get 2 doses in as many people as possible in as short a time as possible, we'll be able to navigate this pretty quickly and pretty easily.
And speaking of those second doses, on Friday you were quoted in a letter by an Ontario public official asking for the timeline between doses of AstraZeneca to be shortened. They've been moved from 12 weeks to 8 weeks. What impact will that have? And I think you've just touched upon it.
Yeah, it's going to be very helpful. And in fact, the second dose approach for people who received a first dose of AstraZeneca is now in Ontario started as of 8 a.m. today. So people can now start booking their second doses at the 8-week mark instead of the 12-week mark. And yeah, as you point out, we've got to really shorten that duration of time between dose 1 and dose 2 to really get maximum protection against this Delta variant. It's here. We can't ignore it. It's spreading. Let's get our first doses in as many people as possible. Let's get that second dose in quickly afterward. And if we do that, we should be okay. We are still ahead of the game. We are still ahead of the curve. But we can look at the United Kingdom and we can see what's happening there. There is a rise in cases, and it is predominantly among unvaccinated people. So let's get those vaccines in so we can avoid that.
Okay, when it comes to second doses, Dr. Bogosh, is the immune response, is it better when you mix and match, or would you recommend staying with the same vaccine if at all possible?
You know, it does appear from emerging data from a couple of European countries that mixing and matching does provide a more robust immune response. We see those antibody levels pretty high after that. There's also emerging data from the United Kingdom that demonstrates that with this particular Delta variant, that the mRNA vaccines do provide people with greater protection. They're just more effective against that vaccine. Having said that, some people aren't comfortable with mixing and matching, and you know, I don't want to speak anecdotally, but when I do have many patients, and I know what my colleagues do as well, we have some patients that say, you know what, I'm not going to mix and match. I'm not comfortable with that. Fine. In that case, the right answer is, of course, you still need a second dose. Get that second dose of AstraZeneca. But we also know that many people are going to mix and match because it's likely that that may provide more protection against this Delta variant.
The first fully vaccinated cruise ship from the U.S. has seen 2 passengers test positive. Does this concern you at all?
It does and it doesn't. I mean, we know that the vaccines aren't perfect. We've known that from the very beginning and from the earliest clinical trials, and we've known this long before, you know, COVID-19 was a thing. Vaccines are really, really good, but they're not perfect. I don't think it comes to any surprise that when you cram a ton of people into an indoor space or a cruise ship, you know, even with testing and vaccination, someone's going to get this. This is a very transmissible infection. And of course, the vaccines don't afford people 100% protection. I think the key questions to ask now are fully vaccinated people who ultimately get this infection, are they getting sick? The answer right now seems to be overwhelmingly no. Yep, there's going to be some rare cases and some small percentage of cases of people that do get sick, but by and large, people that are fully vaccinated, variant or not, tend to not get that sick.
All right, and finally, some big news out of the G7 this weekend, Dr. Bogosh, as Canada announces that we will donate millions of surplus vaccines to developing countries. Just tell us what you make of that announcement and what that means globally when it comes to fighting this pandemic.
Yeah, it's sorely needed. It is sorely needed. Well, we are doing well in Canada, and quite frankly, we have the highest proportion of people in the world with a first dose, at least a first dose, or when we compare ourselves to, for example, other G20 countries, we know that there's many parts of the world that are lacking in vaccinations, and we will have more vaccines than we'll know what to do with. It's extremely important that the countries that have access to vaccines share these vaccines in an expedited manner with low-income countries and middle-income countries that just don't have the same degree of access. It's good for everybody. First of all, it's the ethical thing to do. We have to help those who just don't have access to it. And from a very selfish standpoint as well, at least on a global, it does help Canada as well, right? It does prevent circulating variants of concern from emerging and from spreading to Canada. But of course, the ethical thing and the right thing to do is to pour vaccines into all of those countries. We really are all in this together as a world, and what happens overseas in one particular area will affect other places as well. Let's just get the job done, get equitable vaccine rollout, and we'll be okay.
Dr. Bogosh, thank you as always.
My pleasure. Have a great day.